Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
So, in the fracture of the clavicle, the most common site, sorry, okay. So, in the fracture of the clavicle, the most common site for the clavicle fracture is at the junction of the lateral medial 2/5 and the lateral 2/5 is the weakest point, which is the most common site of the fracture of clavicle. Okay, whenever there is fracture of clavicle, so this is clavicle, there is fracture of clavicle. In such cases, this fracture clavicle is the most common fracture. In the overall, the most common fracture is the fracture clavicle. Most common fracture in newborns is also fracture clavicle. Then most common fractures in delivery is also fracture clavicle. So whenever there is fracture clavicle, there is two things. One, this is the sternocleidomastoid, which pulls the proximal fragment above, whereas the distal fragment is pulled down. Okay, this is because of the weight of the arm pulls the distal fragment down. Even the trapezium pulls it up, but the weight of the arm is more than the trapezius force. So as a result, this is pulled down. So in the fracture clavicle, the proximal fragment is or medial fragment. So here the medial fragment is actually pulled upwards, whereas the lateral fragment is pulled downwards. Okay, then the most common complication of the clavicle fracture is malunion. Then most serious complication is neurovascular injury, where we see injury to the neurovascular injury, where injury is present to the lower trunk of the brachial plexus. Injury is present to the lower trunk of the brachial plexus, and injury is present can be present to the subclavian vessels also.
thank you and thank you for watching.